Hi there, Zachary. My name's Carrie. I'm going to be your student nurse today. Can you tell me your name and your birthday?
Zachary Klein, 4/15/1979.
Wonderful, Zachary. Can you tell me the date today?
6/14/19.
Wonderful. And why are you here?
To get an evaluation.
Wonderful. Zach is alert and appears well nourished. He is oriented to time and situation and person. He is upright and moving easily, no obvious deformities, attentive and smiling. Patient is cheerful and cooperative. Speech is loud and clear, and patient appears well groomed. Zachary, I'm going to take a peek at your skin now. Skin looks within normal limits. Zachary, I'm going to feel your scalp. Zachary is balding, but there is no lumps, bumps, or lesions. Zachary, can you clench your teeth together for me? Good. Can you stick out your tongue? Can you say ah? Wonderful. Zachary's teeth are intact. Uvula rises and falls midline. Tongue and oral mucosa look moist and pink. I'm going to move on to your eyes. Lashes and brows are intact. I'm going to look at your eyes here. The sclera is white. The conjunctiva is pink with no drainage. The iris and cornea look appropriate to the situation. Zachary, I'm going to shine a bright light in your eye. If you could just stare right at my nose. Wonderful. And can you follow my pen light in? Great, thank you. Zachary's eyes are perla at 3 millimeters. They accommodate and they're reflective to light. Can you follow my pen light? No extraocular movements with the 6 cardinal gaze test. Zachary, I'm going to hand you a piece of paper. Can you please cover one eye, your left eye, and read what this says here?
Dad's service.
Okay. And can you cover the other eye for me? And can you read this line here?
And yes, I have checked my car's oil lately.
Wonderful, thank you. Zachary, I'm going to check out your ears now. I'm going to palpate. Please tell me if there's any tenderness.
Nope.
There are no lumps, bumps, or lesions on the left ear.
Nope.
There are no lumps, bumps, or lesions on the right ear. Zachary, I'm going to palpate your nose. Please let me know if there's any tenderness.
Nope.
Okay, can you take a deep breath in? And through the other. Wonderful. Zachary's nares are both patent at this time with no tenderness. Mouth. Can you, earlier I had you say ah, but can you do it one more time for me? Great. Tonsils are 2+ bilaterally. I'm going to look at your neck. Excuse me while I move your beard. There looks to be no JVD, and trachea looks and feels midline with no lumps, bumps, or any tenderness. Now I'm going to have you push against my hand and my other hand and raise your shoulders. Zachary's range of motion, and can you put your head down and up and side to side. Zachary has full range of motion and both shoulders are strong bilaterally in his neck and shoulders. I am going to feel for your lymph nodes. Here, please tell me if there's any tenderness. Preauricular, cervicular, posterior cervical chain, anterior cervical chain, subtonsillar, submandibular, submental, and supraclavicular. There are no lumps or bumps within Zachary's lymph nodes, and there appears to be no tenderness. Okay, Zachary, I'm going to take a peek at your back. If you could just stay in this position, that would be great. There's no obvious deformities of Zachary's back chest. And Zachary, can you breathe a deep breath for me? Both lungs are equal in expansion. Zachary, each time I feel pressure on your chest, do you mind just saying 99 for me?
Sure. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Great, thank you, Zachary. Now I'm going to put a little thump to the back of your chest here. If there is any tenderness, please let me know. I'm going to do it on both sides. Any tenderness?
Nope.
Wonderful. Any tenderness?
Nope.
Great, thank you. It looks, I'm going to listen to your back. I did forget my stethoscope at work, so I'm going to just show the places that I would be listening. Zachary, please take a deep breath each time you feel pressure. Zachary's lungs are clear bilaterally with equal expansion. Zachary is using no extra accessory muscles to breathe. Now I'm going to look at the front of the chest. The front of the chest has no obvious deformities. Zachary, every time you feel pressure from my stethoscope, please take a deep breath. Anterior lungs are equal bilaterally and clear with no extra breath sounds and no accessory muscle use. Zachary, I'm going to listen to your chest here for 1 full minute. Zachary, your heart rate is 77 at this time at your PMI. I am also going to listen to heart sounds now. You can breathe normal. Aortic, pulmonic, tricuspid, herbs, and mitral. Wonderful, Zachary. Thank you. S1 and S2 noted with the bell. Now I'm going to listen with my diaphragm. I'm sorry, with my diaphragm. Now I'm going to listen with my bell. No murmurs, no extra heart sounds heard at this time. Zachary, I'm going to check your upper extremities now. There's no swelling, no obvious lesions. I'm going to feel your pulses. They're 2+ bilaterally. Capillary refills are less than 3 seconds at this time, which is within normal limits, Zachary. Nail beds are pink and hands are warm. Can you please, Zachary, lift your arms up for me and out to the side and above your head. Zachary has full range of motion in his shoulders. Now, Zachary, I'm actually going to have you lay down for me. I'm going to assess your abdomen. Thank you so much. Zachary's abdomen is slightly rounded. with no obvious lumps or deformities at this time. Zachary, I'm just going to listen to your abdomen here first. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, vowel sounds heard in all 4 quadrants. Now I'm going to listen to your aortic bruit. Wonderful. Now I'm going to percuss your abdomen. This will not hurt. How donuts hurt in your abdomen, Zachary. Now I'm going to palpate your abdomen. If you feel any discomfort, please let me know. I'm going to start with a light touch. Zachary's abdomen for light touch has no lumps.
No.
And no pain. Now I'm going to press a little deeper. Any discomfort, Zachary? No discomfort for Zachary. There's no masses or bumps of any sort within your abdomen. If you could go ahead and, oh, I'm sorry, I'm going to do your legs now. Lower extremities do not look discolored. They are warm to the touch. Zach, I'm going to feel your pedal pulses and your posterior tibialis. Both 2+ bilaterally. Zach, I'm going to do a little range of motion with both of your legs, okay? So if you'll just raise this right leg up, bring it towards your chest, bring your knee in, knee out, and back down. Zachary has full range of motion in the right leg. Lift your left leg, bend, and knee in and out. Zachary has full range of motion in his left leg. No abnormalities, no bruises, no swelling, and no discoloration. Okay, Zachary, you're welcome to sit up for me, please. I'm going to check your neurostatus now. I'm going to use this cotton ball. I'm going to touch you in many places. Please tell me exactly where I'm touching you at. Please close your eyes.
Left cheek, right cheek, left bicep, right bicep, left forearm, right hand, left hand, left knee, right shin, left foot, right.
Okay, thank you, Zachary. That was wonderful. Okay, now I'm going to have you move your arms rapidly. If you could stick them out and then flip them back and forth multiple times, wonderful. Thank you so much. That was great. Can you take your heels and from your and drag them up your shin? Thank you. And your other heel. Wonderful. And then I'm going to test your reflexes. This can be a little discomforting, Zachary, but this, the right bicep tendon, the left bicep tendon, the right patellar, the left patellar, the right Achilles, the left Achilles. Thank you, Zachary. All your reflexes are appropriate to. I'm actually going to have you stand up now, Zachary, if you could, please. And can you walk to the fireplace and back, please? When you turn around, please walk heel to toe. Great, thank you. And you can stop right there and put your legs apart for me. And I'm going to test your balance. if you could raise your arms out and close your eyes and raise and stand on one leg. Wonderful. Zachary's balance is intact. Zach, now I'm going to test the range of motion in your spine. Can you bend forward for me? Good. And back up. And then side to side. Good. And then can you twist for me? Wonderful. And Zachary, I missed one of your reflexes. If you could just have a seat for me, that would be great. I'm just going to touch the bottom of your feet if it's uncomfortable, or it will be a little uncomfortable if you're ticklish. Okay, Zachary, thank you so much for your time today.
Thank you.